Greetings, everyone, and welcome to the webinar, Prevention is Protection, Transforming Child Welfare and Strengthening Families. Thank you for joining us today on the webinar for our second panel. We hope you were able to join us earlier for our first panel. Before we get started, I'll share a few housekeeping notes. To minimize interference on the line, all attendees will be muted for the duration of the webinar. You can use the magnifying glass icon in the upper right of the slide panel to increase or decrease the size of the slide on your screen. If you experience any technical issues during the webinar, click on the chat icon and let us know what the problem is. We'll do our best to help troubleshoot any issues. Also, please use the chat panel to submit a question for our speakers. We will be holding time at the end of the session to answer your questions. We'll collect all questions submitted and get through as many as possible during or at the end of the session. This session is being recorded and will be posted on our website for future access. We are also live streaming the event to our Facebook page if that connection is better. And with that, we'll begin. Good morning. My name is Alisa Santucci, and I am a Principal Associate at APT who oversees the Child Welfare, Youth, and Family work. April is Child Abuse Prevention Month, and today we're excited to bring together an outstanding panel of experts to discuss how we can work together to protect children and strengthen families. Over the next hour and a half, you will learn about the important work of our panelists and current efforts underway that are addressing the COVID pandemic. Before we get started on our panel, we want to hear from you. As I mentioned during the first panel, so many of us are from different organizations and play different roles in the field. There's a link in the chat box now. We would like you to click on the link and share your thinking on our question. Can you tell us in one word what you think is the most pressing need at this time to strengthen families? When you're done answering the question in your web browser, simply click back on the WebEx webinar to see the presentation. Now I would like to introduce our distinguished speakers. Each of our speakers will give a brief introduction of themselves and their work before we transition to our discussion. You can read more about our speakers in our e-program brochure that's available on our website. We'll also add the link to our chat box here. Our speakers for this webinar are Raven Segura, a Friends National Resource Parent Advisory Council member, Dr. Valerie Spiva-Collins, the Director of Friends National Center for Community-Based Child Abuse Prevention, Deborah Northberg, Director of Child and Family Services and a Community Collaborations to Strengthen and Preserve Families grantee at Cook Inlet in Anchorage, Alaska, and Dr. Allison Hyra, a Project Director at APT for the Community Collaborations to Strengthen and Preserve Families project. And now we'll begin. April is Child Abuse Prevention Month. For those who are joining the webinar today and may not be familiar with your work to help prevent child maltreatment, can you spend, each of you, a few minutes introducing yourself and your work to our listeners? Raven, we would like to begin with you.
Good morning, everyone. My name is Raven Segura. I am the first camp partner here in Louisiana. I'm the first camp partner here in Louisiana. My position I hold is very near and dear to my heart, and it's from my own personal experience. As we move forward today, discussing families, I would like to include that I was once one of those. My family and myself was once a part of the child welfare system. So it's from that my passion and my drive is so strong the way that it is. So in my role, I help parents navigate the child welfare system, whether it be accessing resources, finding treatment, whether it be mental substance abuse. I transport. I do everything in my power to help them navigate the system successfully. Thank you.
Thank you so much, Raven. Valerie, would you like to share next? Thank you.
Yes, good morning, everyone. I'm Valerie Spiva-Collins, and I want to thank Apt Associates for inviting me to participate, and including friends on this panel. If you'll go to the next slide, please, I'd like to share who we are and who we serve. Friends National Center for Community-Based Child Abuse Prevention is a child abuse prevention training and technical assistance provider. We're a program of Chapel Hill Training Outreach Project in Chapel Hill and Durham, North Carolina. Friends is funded by the Children's Bureau within the Administration for Children and Families in the U.S. Department of Health and Human Services. We provide training and technical assistance to CBCAP state lead agencies and resources for the universal audience, anyone interested in child abuse prevention. Every state, D.C. and Puerto Rico, plus 3 tribal and migrant grantees receive CBCAP dollars, although the amounts are pretty small. They're relatively small. And these state lead agencies are housed within Department of Social Services, Departments of Public Health. Some are in private nonprofits like Prevent Child Abuse America, state chapters, or in children's trust funds. Next slide, please. For CBCAP state lead agencies, we provide both distance and on-site training and technical assistance in a variety of areas, and I've listed some of them on the slide, as you can see. But for those on the call who may be outside of the CBCAP community, you might be more interested in some of the other resources that we have available. For anyone interested in information and resources, you can visit our website. The address is on the screen, www.friendsnrc.org. And I just want to share a few highlights from the website to give you an idea of some things that you can find that may be helpful to you in your work. First is something we call Sharing the Journey, and there are a number of video and audio recordings on the website of parents with lived experiences, and their experiences are in a variety of areas. These can be good to listen to as an individual, but if you're somebody doing a training or working with a small group of people, you may want to share one or more of these recordings around homelessness, what it's like to experience incarceration, substance misuse, losing your children, what it's like to just need a little help, just a little boost to keep your family afloat. So all kinds of stories are available for us to learn from and to share with others. If we can go to my last slide then, please. The other few things I'd like to share, many of you may be familiar with our Protective Factors survey, and the protective factors are so important to our work. Some of our partners really help states and communities to engage and learn more about the protective factors and promote them in families. This survey helps agencies and programs better assess changes in family protective factors. So programs might use it for program improvement, for CQI. We've just come out with a more updated version of the survey, working with our partners at the University of Kansas Center for Public Partnerships and Research. We also have a logic model builder, and it sits on the Child Welfare Information Gateway website, and it's an excellent tool to use for program development. So it helps people to create a plan with inputs and activities and resources and what their expected outcomes might be. It's also very good for folks looking at developing an evaluation plan, which we think is important to all programming to figure out how you're going to evaluate your implementation and success. Our Parent Advisory Council, which Raven sits on, and we're very proud of this group of parents, they produce a parent and practitioner newsletter 2 or 3 times a year. All of the editions are on our website, and some of the recent editions, each has a theme, I should say, but the recent editions cover trauma and resilience, homelessness and food insecurity, infant and child safety. So within each of those topics and themes, there are articles from parents, from practitioners, from a variety of people who PAC members have recruited to contribute to the topic of a particular edition. And they're available in English and Spanish on our website. The last few things I'd like to mention, there is a child neglect prevention toolkit with many resources, a collaboration toolkit, because we know how critical it is to collaborate successfully and partner with other organizations to do the work that we do. There are resources to help you do cost analysis of your program services. And finally, we have podcasts. And up until today, I could only say that we had one podcast that we've had out for about 18 months. It's called ACES, Historical Trauma Among African Americans and Resilience. That podcast, last we looked, had been downloaded over 21,000 times. So I think there's been a real desire for people to look at the issues around equity and inclusion, trauma, and historical trauma. And we hope to add to that theme, podcast around that topic. As of this morning, I'm able to say that we have now posted a small series of podcasts related to COVID-19, but also to help anyone, families, parents, deal with crisis that they may be facing. And we've produced these in partnership with the Jordan Institute for Families within the School of Social Work at the University of North Carolina at Chapel Hill. And you'll find 5 type podcasts that address managing family stressors, helping older adolescents with some of the losses that they're experiencing now, whether it's not having a graduation, losing out on spending time with friends, not having a prom, just a whole variety of things. And there's a podcast on self-compassion. We know all of us are struggling for different reasons, and we may be hard on ourselves. And so that one addresses how we might have self-compassion, but also show compassion for others. So there are 5 total, and I would recommend that you check those out, and they're very brief, and hopefully you'll find some useful tips. Thank you, Alisa.
Thank you so much, Valerie. Those are excellent resources, and the podcasts sound really wonderful. Deborah?
Good morning. I'm Deborah Northberg. I serve as the Senior Director of Child and Family Services at Cook Inlet Tribal Council. I've had the pleasure of representing the organization for the last 17 years. Next slide, please. I'll tell you a little bit about who we are and what we do. Cook Inlet Tribal Council is the social service arm of the Cook Inlet Region Corporation. That's one of 13 tribal corporations in Alaska that were organized in the state's Land Claims Settlement Act. The Cook Inlet region spans 38,000 square miles and is represented by 8 tribes. Anchorage, where we are located, is the largest hub city in the region and state, with a population of nearly 300,000. And we're approximately 40% of Alaska's total population. So because Anchorage is the urban hub, our population is both multi-tribal and diverse. Our mission is grounded in the collective we in our work to develop opportunities that fulfill the endless potential of our people. As we've operationalized this mission, the organization has worked to incorporate core values that really are the lens of our purpose. And these are interdependence, resilience, respect, accountability, and most recently we've added humor. And although not a core value, our board of directors has recently claimed spirituality as central and critical to how we carry out our mission. Next slide, please. CITC is intended to be a one-stop shop in Anchorage, and we have a broad array of services through 4 key areas that are operated within the organization and through subsidiaries of our organization. Our education services include Early Head Start. We have dedicated classes in the Anchorage School District in a pipeline of schools. We have after-school and summer enrichment camps, and operate a Native Youth Olympics annually. And We also have a fabrication lab on our campus that kids and others in the community have access to. Our Child and Family Services, which I oversee, includes prevention, early intervention, family preservation, and supervised visitation and reunification supports. We have worked in very close partnership with the local state child welfare system over many years to develop new strategies and different opportunities that support our participants who are historically disproportionately represented in our child welfare system. Our employment and training services area includes tribal TANF, GED support, tribal vocational rehabilitation, and workforce development opportunities. We've most recently established Alaska's People as a specific program to assist people in work readiness and recruitment. Finally, our recovery and reentry services include assessment, inpatient and outpatient treatment, and a residential reentry program that's modeled after the Delancey Street program in San Francisco. So we are striving to create opportunities for the whole person and multiple generations. And next slide, please. We are so excited to be a part of the first cohort of Community Collaborations grantees to strengthen and preserve families. The 4 core areas of our Community Collaborations grant are first, to shift the landscape of prevention services and work toward creating a more integrated support system that meets families where they are, both psychologically and geographically. We're very interested in ensuring that families are using personal agency to determine what it is that they need and working toward better processes in order for families to access those services. We are working to increase access to mental health services and navigation for prevention services. Initially, we have thought about really broadly how people can access mental health services and potentially even on site at our organization. We have since, through our planning process, refined that strategy to think more about short-term, present-focused check-ins and access to that type of support. It is intended to be episodic and when it's needed, and not a diagnose and treat type of service. We also will provide navigation for participants of our organization and partners. We'll be providing check-ins to families and additional support in linking to services as requested. We will offer groups and peer support activities in order to engage and help people build community. We certainly understand Anchorage as a large city. We have a lot of people moving in and out of Anchorage, particularly from the rural areas. And Anchorage is a very difficult place to find support. So we seek to help people in that endeavor. We also are focused on integrating cultural and trauma-informed practices in a protective factor approach within our prevention services sphere. In Cook Inlet Tribal Council and our subsidiaries and within key partners, we'll be looking to create a cohort, a learning and advising cohort to both learn and plan to generalize these types of strategies within our community. And lastly, we have been for years focusing on a jointly owned whole family outcome measurement system. within Cook Inlet Tribal Council across our various services, we have, over the last few years, developed something we're calling the 5 factors that is similar to protective factors survey. We compiled that as a result of a literature review, stakeholder interviews with participants and staff that resulted in our first iteration. We've gone back to focus groups for feedback and have made additional changes, and we'll look to pilot that again this year within our organization, looking at whole family outcomes. Thank you.
Wonderful. Thank you so much, Deborah. And Allison?
Hi, good morning, everyone. My name is Allison Hyra, and I'm a senior associate at Apt Associates. We're a research and evaluation firm in Maryland, and I have more than 15 years of professional experience in family and youth research. Next slide, please. So I have a pretty wide portfolio of projects here at Apt, but my work focuses on work that furthers the mission of the Administration for Children and Families within the U.S. Department of Health and Human Services, and that division is often called ACF. I'm heavily involved in Apt's child welfare portfolio specifically, including as a reviewer for the Prevention Services Clearinghouse, which you all might know as the legislatively mandated evidence review to determine which programs state child welfare systems can implement with federal financial support. But my most relevant project to this discussion today is as the project director for the Community Collaborations to Strengthen and Preserve Families projects. It's quite a mouthful, so we call it CWCC, Child Welfare Community Collaborations. Apt is the prime contractor on this project, and we work side by side with our partners Child Trends and consultant Dr. Sharon McGroder. This project is overseen by ACF's Office of Planning, Research, and Evaluation, and it supports Children's Bureau grantees. The Children's Bureau has funded 2 cohorts of grantees to develop, implement, and evaluate community collaborations to prevent child abuse. Each grantee has designed specific collaborations that best reflect their community's needs, assets, goals, and cultures. In general, though, our grantees are building relationships and partnerships with both traditional human service and child welfare organizations, as well as non-traditional partners such as the business and the faith communities. The underlying logic of these grants is that families should be provided services and supports before they come to the attention of child welfare systems, not after. That child maltreatment can be prevented by linking families to services that are largely already available in their community and that align with each family's profile of risk and protective factors. For this project, Apt and our partners are supporting the grantees in 2 separate but related ways. 1, we are conducting a cross-site process evaluation to document and understand the various approaches that grantees are using to build their collaborations and to connect with and serve families. And 2, we are providing evaluation technical assistance to support each grantee's local implementation and outcome evaluations. And as she already mentioned, I am thrilled to be on the panel today with one of our CWCC grantees, Deb Northberg from Cook Inlet Tribal Council. So in a nutshell, my contribution to the field of child welfare is as a director of an amazing team of evaluators, as we either directly generate evidence around how communities can come together to prevent child maltreatment, or indirectly support evidence building through the implementation of high-quality local evaluations. I'm really excited to be a participant on this panel today and to share our project's bird's eye view of how community collaboration grantees are adapting to our new world and how our evaluations are changing as a result of COVID-19. And finally, I do need to say that today I'll be expressing my personal opinions and thoughts, and that my comments do not necessarily reflect the views or policies of the Office of Planning, Research, and Evaluation, the Administration for Children and Families, or the U.S. Department of Health and Human Services. Thank you.
Thank you so much, Allison. So we're going to begin our discussion. Please feel free to, in the chat box, ask questions of our panelists, and we'll do best also to get to those questions. Across the country, we know that all families are struggling to respond and adapt to COVID-19. Yet for those who are system involved or already vulnerable, this public health crisis is creating more stress and demands. Can you each take a few minutes to share what you're learning from your work about families, how families and communities are coping? Raven, you might be on mute.
Yes, thank you. I know that I can personally say that COVID is such a strong word right now, as we already know from the stress already before the crisis. But now I'm seeing that parents are, the families that I serve within my caseload are having these feelings of, of just being, just feeling abandoned and defeated right now. As some things are starting to open up, such as telemeds and, teleconferences, and but still there's this issue of transportation for it. So they're feeling like it's if, again, my job, I come in is to help them and empower them and show them there's light at the end of the tunnel. But when you're constantly getting these slaps in the faces and kicks in the gut, it's kind of hard to keep that momentum going within my teachers and my. But I just want to share this. We all know that there was a stimulus sent out, and SNAP has given extra food stamp benefits. But that's only to. I mean, we've been out of work. Some of the parents have been out of work for almost 2 months now. So that's just 1 month of assistance to help with month of bills. And these parents don't have the kids in home, so they just qualify for that $1,200. So it's just to catch up and barely catch up from last month and pay bills. So they're feeling let down and defeated. And I'm actually trying to get them to understand that this too shall pass. But it's hard right now. It really is. Thank you.
Thank you, Raven. And that point of view is so important for this dialogue because, many of us, because of the fact that we're so isolated, do not have a lot of insight into what's happening outside of our immediate family and friends. So I really appreciate your participation on this panel and for you helping us understand the reality of what's happening with our parents and the work that you're doing in your community. Valerie, I'm going to transition to you. What are you hearing in terms of the Friends Network?
Yes, thank you, Alisa. I'll say that primary and secondary preventionists, like the service providers funded by CB-CAP dollars, focus on families that are not system involved. They're not in child protection, but they're families who voluntarily or perhaps through a recommendation from a service provider are accessing supportive services in their communities. And primary prevention serves most families because we know all families run into crisis points at various times. And prevention programs support families who may be struggling due to substance misuse, teen parenthood, being a parent and a former foster care youth. They may be struggling due to financial struggles, incarceration of a family member, and many other reasons. So some of the same issues that those families that are system involved have as well. COVID-19 has made most aspects of life harder for all families, but particularly for families already dealing with complex challenges. In locations, for example, where fatherhood programs were being offered in county prisons, those programs have been suspended. So in the long term, if these programs cannot be restarted, then these fathers miss the opportunity to learn how to reconnect with their children, how their own trauma may impact their children, and how important well-equipped fathers are to young people. As Raven was saying, this is a very difficult time, more difficult than usual for families suffering domestic violence and for children who are missing school and maybe living with an overwhelmed parent who doesn't have support. Many families are dealing with food insecurity and reduced social supports. So I've mentioned a lot of the challenges. I look forward later in the call to sharing examples of how CBCAP-funded prevention programs are responding to some of these needs in their communities across the country. But for now, I'll pause and wait until a little later when we get to that question.
Thank you so much, Valerie. Deborah, can you speak a little bit about your community and some of the challenges that they're facing as well?
Yes, and thank you, Valerie. Many of the things that you described, we are observing as well in our community with people who already have complex challenges. The impact of COVID is different. And we observe in our community that this public health emergency disparately impacts people in our community. We all are experiencing some amount of stress related to the uncertainty of what's happening economically and with our families and children, although people who have different histories and physiologies and contexts and belief systems experience what's going on globally in our communities very, very differently. We've seen this in our participants and really in the staff who are working with them. So we've mobilized internally and in partnership with others in our community to meet immediate basic needs as best we can. Initially, we weren't seeing that, but more and more we're seeing requests for assistance for basic needs. We've responded in our organization by establishing an additional supportive service funds to deploy that quickly to people. I think it's particularly challenging for parents and children who are separated from one another, and we really are working to try and get technology in the hands of families who need it. We're also focusing, though, on coping and wellness, not just for participants, but for staff using technology, such as video conferencing, but really just highlighting the benefit of presence with one another. So just as our managers are spending that time being in presence with staff and just being a bit human and recognizing that there really is a benefit in that, we ask our staff to do that more frequently with our participants as they're able to connect with them. Oftentimes in our work in social services, our work can be very transactional, and some of our staff feel very uncomfortable about just being in conversation with participants and not being able to do with them tasks. And so we're seeing this as a great opportunity to move our services from transactional to really transformative. We've also seen the stress in our staff who are almost all working telecommuting at present. And we've responded by building into everyone's virtual workday up to an hour of self-care activities and providing an allowance to staff for technology or other kinds of things that will support coping, such as a mindfulness app. I'm particularly fond of the Calm app. So we recognize, as one of our managers said, we're in a perpetual state of adaptation and things are changing day by day. And so coping is critically important for all of us.
Thank you so much, Deborah. I appreciate in your earlier comments the way you spoke about adding humor and spirituality and bringing in mindfulness. I think that these are really important additions to how we face our day and can be excellent ways to have a restorative moment in such a stressful time. So I appreciate you bringing that into the conversation. Raven, one of the things that we have been talking about with this work is the challenges around teleconferencing and being able to maintain family connections. From your work with parents, what has or has not worked with virtual communication? Can you speak a little bit about that?
Yes, I know that I can say that when it comes to the virtual, conference communication, it's not, quite frankly, some foster parents are still not willing to allow these virtual to happen. And on the other side of that is it's depending on the relationship the worker and the bio parent had before the epidemic. Were they given phones with the capability, the virtual capability, shall I say? So it's kind of like true colors are being shown, and I'm stuck all day really trying to calm these parents down and talk to them and being the mediator, with the worker, trying to get them to understand how important these visits are. So I know that there was a check-in, and workers were instructed to do check-ins with the family, with the bio parents, and see what type of technology they had. Were they able to do Zoom meetings, just the virtual visits at all? And if not, but again, it depends on what was the relationship between the two. So I still have parents that don't have that technology. I'm actually going to go out this week when I'm through with this call this afternoon and get a phone and drop it in one of their mailboxes. Since we just found out that the worker is the one that's not allowing this to happen for one of the families that I'm working with. So I'll go out and purchase a phone. And that's what I have been doing. If they didn't have the technology, I'll put the data plan on their phones. I thank God that I'm blessed to be in a space to be able to do that, especially seeing how these true colors are really coming out. But then the foster parents are not complying and still not letting the virtual visits happen. And that's where we are right now. I just got a call. I'm sorry for my haste introduction, but that was a parent on the phone. They had a visit that was supposed to take place this morning, and the worker called and told the foster parent not to because they hadn't answered her call. And here I am to mediate this. So these visits still aren't happening in the manner that they should be, and that's where we are. Thank you.
Thank you, Raven. I think that really echoes a lot of the conversation that's going on around the nation about the struggles on the local level to connect parents at all levels. And so I, again, want to reiterate how grateful we are to the work that you're doing and for you taking the time to share those struggles. It's important, I think, to amplify the needs of what's happening with families on the ground across the community. And Allison, I just wanted to turn to you. I know that the community collaborations grantees were intended to help really support the infrastructure of resources for families. So I just want to give you a minute to talk about what you're learning from your work about families and communities and how they're coping.
Sure. Yeah, I think that the community collaboration grantees' theoretical models are particularly important at this time because They're designed to link to people who were not already system involved. So they're really set up to connect to families that previous to the pandemic didn't feel overwhelmed or didn't need services and don't know what services are available or how to connect to them. Our grantees are working to reduce the stigma associated with seeking help and support to address family changes. They're breaking down barriers and silos associated with the various categories of supports that should work collectively together to address risk factors associated with child maltreatment. So the way the community collaboration grantees work is that these connections across systems allow a family to walk into one door to apply for TANF, say, for example, and then also be referred to other existing programs that are designed to meet the family's other goals and needs, such as parenting education, rent support, respite care, or mental health counseling. We know that families are multifaceted, and we know that folks' challenges don't always align with the way our professional human services silos have been designed. Additionally, the grantees are really building like non-stigmatizing entries into collaborations through hotlines, informational websites, now virtual parent cafes, but sort of easy entries that don't feel like folks are entering into a world where they are one step away from having a formal case opened against them. And finally, these grantees are purposely adopting strengths-based and parent-driven approaches. They're conducting outreach broadly under the assumption that parenting is hard and everybody could use a partner in that work, and no more than today. And that families do know what they need, and that families should be the drivers of determining which services and supports they are interested in or able to engage with at that point in time. And that all families have assets and strengths, even in this troubling time, and that programs are better received by families and more effective in family functioning when the programs recognize families' talents, resources, and strengths, and build on those advantages. So I'm really excited that we have this model already operating in 13 sites, and I'm really hoping that our research will eventually indicate that those systems and collaborations on communications of eligibility, data, program alignment will be harnessed in a way that we can quickly adapt and move forward in supporting families during this pandemic.
Thank you, Allison. Valerie, I know that Friends works directly with the CBCAP leads and really also has a lens directly to the community. Can you share some insights as to what you're learning about how services are being provided to parents at the local level?
Yes. I want to start by saying I really appreciated what Deborah said about moving from transactional to transformative. I think that's something we all are or should be striving for, that making transformation for families, having them experience services or support in a transformative way, I think goes a long way to help them with long-term meaning and change to get to a better place. And just thank you, Raven. I think, hearing the details of what you were dealing with even this morning, I think keeps us focused on things on the ground and the needs that are out there. As we talk to many of the state leads who fund local programs across the country, we are hearing how services are being modified during this time. And all programs, of course, have suspended services requiring face-to-face contact. Most are using telecommunication, whether it's FaceTime, Skype, Zoom, or the good old-fashioned telephone, which in many cases is a smartphone. In Pennsylvania and in some other states, we've learned about work to continue providing group fatherhood classes using technology, and in some cases, reaching out to members of groups one-on-one if they need extra support or if they don't have the technology to participate in the group. In Delaware, we've heard about community-based health workers who have been making deliveries of essential items like diapers and formula to program participants. Many other states are doing that as well. They found that the demands on their food pantries through their family resource centers have enormously increased. States have found that creating online support groups for home visiting supervisors is something that has been useful. I think it goes back again to what Deborah said about staff needing that extra support too during this time. States that fund the use of national models are following the recommendations of the national offices, is what we are hearing. Whether it's Triple P, Parents as Teachers, or Safe Care, or other examples, if you were to go to their websites, you'd find front and center recommendations for the practitioners of those models as well as for families. In West Virginia, we've learned about them hosting online group activities, story reading, encouraging families to keep in contact with one another. We know how critical social connections are and support are for all of us. One of their local family resource centers challenged each of their families to have a dance party and video share their family dancing within a private online group site. And so they're making efforts to build family cohesiveness, to bring some fun and release to people, and again, build social connection. Birthing hospitals in Wisconsin are still handing out newborn education materials, and their family resource centers that would normally conduct follow-up visits with some families are conducting follow-up calls, and this is part of their Period of Purple Crying program. So a number of examples across the country of how practitioners are trying to remain in contact with families that they serve, provide support as needed, and hoping that families will remain in touch as they can and as they're feeling need.
Wonderful. Thank you, Valerie. Deborah, I know that you're providing a wide range of services to families. Can you share how you've adapted your service provision to families in light of COVID-19?
Yes. We've actually been thinking together about how we have really benefited and been able to leverage our lessons learned from the recent natural disaster in our city. That was November 2018. We were displaced for more than a year from our building during restoration after that earthquake, and really had to very quickly figure out how to provide services on site and in a different way and remotely. And so I think because of that opportunity, we really were quickly able to move back into a teleworking remote way of providing services for our participant. The biggest difference, of course, is that we were still able to meet face-to-face after that earthquake, and although it was a long period of transition, the way in which we were better able to connect with people was a big benefit, and we recognize that as we've moved to both telephonic and video conferencing platforms, some of that is compromised. It certainly has been a bit bumpy for both staff and participants for various reasons, transitioning our services to those platforms. Reasons that have been talked about, such as technology. Not everyone has what they need to meaningfully participate. Some of the platforms are not very user-friendly for everyone, and people have varying levels of comfort about being on those kinds of platforms. But we have done groups and supervised visits and classes via Zoom, and for the most part, those have been well received. But we recognize that because this is a different kind of interaction, that we really do need to have more frequent interaction with people. We are also struggling to find the right platforms to secure consents and other signatures so that we can keep providing intakes to people and engaging them in services. We certainly recognize that in terms of accessibility, this has always been a goal, to use technology to make it easier for participants to apply and engage in services. This this COVID-19 crisis has provided, again, another opportunity to really spur us into making decisions and critically thinking about how we do it. So there really are some potential long-term benefits of the problems that we solved during this period. And we're not just problem solving, but using this as an opportunity to think strategically in long term regarding really how we deliver services. We're watching closely the challenges and benefits of delivering in this type of way, not just as a short-term solution, but with an eye toward what are those strategies that we can sustain to work with children and families ongoing. We're thinking this might be a little bit of a pivot point for sure. We live in a world where virtual relationships are very common, and we fully expect that some of the current accommodations will become enhancements to our services moving forward. Perhaps as a way to reduce common barriers to using some of our services, such as transportation or childcare. We've contemplated over the years the consequences of virtual identities and relationships in social media, but really haven't considered the opportunities beyond outreach through platforms such as Facebook. And I think the use of video conferencing is helping us to do that.
Thank you so much, Deborah. I want to ask Allison also about how, can you talk a little bit about the project and the local evaluators, and how are you changing evaluation plans and activities in response to COVID? One of the important parts of understanding needs is data collection, and right now that's something that's very difficult, and people are struggling with how to adapt. So I wanted to also make sure we gave you an opportunity to bring that into the conversation.
Yeah, great. Thank you. So across the grant initiative and then our own process evaluation study, there are sort of like 3 categories of life stages of evaluations that are occurring right now. There's our project's cross-site evaluation. There is the second cohort of grantees who are in the planning and design phases of their evaluations, and the first cohort of grantees who are about to start or are already in the midst of data collection, and they all kind of shake out differently. So starting with the cohort of grantees who are just planning their evaluations right now, they have a whole year of a planning period in their grants. Most of those evaluators are able to keep moving forward on their work. Their big challenges lie with the extended effort the grantees are extending to address the pandemic. So some of these grantee organizations are pivoting to the really immediate needs of children and families, and aren't finding that extra time to engage in planning calls and meetings to flesh out their implementation plans. As we better understand the potential timelines for social distancing, we expect that those grantees may revise their grant plans, both in scope and areas of service, and the methodologies by which services are delivered, which we've already kind of talked about. So to the extent that those changes affect the evaluation plans, in terms of research questions, samples, and data collection options, our second cohort grantees are challenged to think about how to continue to make their evaluation plans align with the grantees' implementation plans and are feasible given whatever restrictions we have on in-person engagement at whatever period they're going to be conducting data collection. Now, our evaluators who are working with the first cohort of grantees, which includes Cook Inlet, they are about to begin or already in active data collection. So they're addressing several challenges vis-a-vis the pandemic. One is how to collect data. So collaboration level activities have largely moved to email, phone, and virtual meetings. And so the process evaluation data collection has had to follow that transition to be able to collect data. Data from participants has had to shift even more. And our evaluators are actively working through ways to convert their plans, including changing pen and paper instruments to online surveys, establishing electronic procedures for consent to participate in a study, and determining how to get instruments to folks who might be on the other side of the digital divide. For example, our grantee in El Paso is texting links to surveys because research suggests that Latino populations are more likely to have cell phones as compared to traditional desktop or laptop computers. El Paso is also developing mailing procedures to get those pen and paper instruments directly in the hands of people through the U.S. Postal Service. Our Cohort 1 grantees are also monitoring grantee shifts in activities as a response to COVID to determine whether they need to revise or augment their evaluation plans to systematically capture those shifts. Those changes include additional research questions, data collection instruments, samples, etc. And then finally, our evaluators are very conscious of the need to document their changes in plans and activities to ensure that Children's Bureau and the IRBs that approve their studies also sign off on those changes. In terms of our project's cross-site study, we are supposed to be fielding an online survey to Cohort 1 grant staff right now, and we had selected dates to go on site to conduct interviews and observations. That is obviously not happening. We initially, about a month ago, decided to just take a step back and pause. We wanted to get a better sense of how the pandemic would unfold, and we spent that time developing a number of contingency plans or alternatives to data collection. After 2 weeks, we revisited the study with Children's Bureau and OPRE. While our exact path is not fully solidified, we did establish some guiding principles towards evaluation during this period that I think would be helpful for anybody collecting data right now. One, we think in-person data collection is off the table for the foreseeable future, and we think that our interviews will have to occur by phone. Two, we recognize that our grantees are at the forefront of supporting families affected by COVID, from providing emergency child services to concrete support linkages for unemployed families, to addressing the lack of childcare and time that children would have spent at school and how families are able to still work in this environment. We really didn't want our study to be an additional mental or time burden. So we have decided that it's really important to work one-on-one with the project directors of each of our grantees to align our data collection with the timeline that they feel is appropriate for engaging in this additional activity. We also are developing trauma-informed training specifically for our data collectors in acknowledgement of what a difficult time this is and to ensure that our study does not further complicate folks' professional or personal lives. And finally, for our third principle, we decided that the pivot that grantees are making, the strategies that they're adapting to support families, and the lessons that they are learning through this process are too important to ignore. We can't pretend that our data collection instruments that were developed a year ago are capable of collecting information about what's happening right now. So we're revising our data collection protocols to capture this information systematically, and are partnering closely with our IRB and our federal partners to ensure that we can field these instruments to capture the way that grantees are responding to and successes they are finding in their responses to COVID. So in short, the CWC evaluators writ large are putting grantees' needs first, practicing being nimble to continue to align our studies and activities on the ground.
Thanks so much, Allison. We had a question come in to the chat around families in recovery. And Raven, I was hoping that you could talk to us about some of the challenges that you might be experiencing related to connecting with families and connecting resources to families, and opportunities if there are innovative ways that that's happening in your community. And you might be on mute.
Yes, thank you. So that was one of my biggest issues. I'm real big on parents getting the substance abuse, they need. That was one of my biggest challenges. Was we know that everything with the COVID-19 going on, everyone was ordered to, it was a stay-at-home order. We were ordered to work from home. That meant resources were closing its doors and trying to figure out a way how to communicate with parents dealing with substance abuse. And I know that, within my caseload, I had a few that relapsed. They weren't letting any in. There weren't any face-to-face visits. And at this time right here, right now, what we don't need is for them to fall back into that trap, in which some of them have, because we don't realize how they really need that interaction. And they have to find strength in something until they gain it on their own. So not having these face-to-face visits and these meetings has really thrown them in a place, not just quarantine, isolated. They're isolated and using because there's nothing else right now. But what I can say is, as of last week, Tyler Mental Health and which is a substance abuse disorder clinic, as well as Key Sober Living, has been opening back up meetings, virtual meetings by Zoom, to get them back into a more structured setting. And right before this pandemic occurred, I was doing some work with our preservation coach, which is a family judge that interacts with families that are not only just involved with the child welfare system, but also suffering from or dealing with substance abuse. And there was a big write-up about it, and it was so the big issue with that was that there were families that weren't identifying with higher powers, whether it be just come from their culture, they weren't, this wasn't included in their culture, or, handed down generations just didn't believe in her higher power, shall I say. So there was parents that were not getting involved with meetings, not going, which was a recommendation, a requirement for them in this family preservation program. So I was given the task of coming up with an agenda and a meeting to help reach these parents. And with the pandemic happening, I just decided to push the date up because we need to reach these parents ASAP. We can, so tomorrow is my first Zoom meeting. I have not named it yet. I want to get a feel of the meeting, the people, and how it turns out. But I was hoping that this Zoom meeting could tap into some of, those protective factors, the social and emotional competence, and just tap in, and also tap into their substance abuse issues. Because I firsthand knew that was my problem with addiction. I needed to be around like-minded people. I needed to see and be around and be influenced by people that wanted to live clean and that knew how to do it, because I didn't. I'm grateful to be standing here, 11 years clean now, but I needed those people. I needed to be around those people. So hopefully we can get something going, and I hope the first meeting tomorrow is a turnout. So thank you.
That's excellent. Thank you, Raven, for that suggestion. And Deborah, I want to pull you into this conversation because I know as a service provider, there are a wide range of services that you provide. Can you speak to anything specific to substance use that your organization is doing?
Mm-hmm. As I mentioned, we are conducting business as usual with our recovery support services, assessment and treatment groups through video conferencing. We're using the Zoom platform. They've developed a pen and paper process to complete intakes and get consents so that participants can begin services. I think the service that excites me the most is the peer recovery coaching that happens within our recovery services. And we have peer recovery coaches that really are available to families 24/7 who are in recovery or moving toward treatment. They not only do that by telephone, but they will even participate with families virtually on the Al-Anon and AA meetings that are happening. So they really are just standing in the gap, I think, for people who are struggling without support.
Thank you so much. Valerie, there's a question in the chat around the importance of community engagement and being able to really connect to families to find out who has needs and being able to connect them to the right resources. And I know that's done through family resource centers throughout the country, but I was hoping you might just speak a little bit more about the role of community engagement and the CB-CAP network and the kinds of things that are happening to help support that connection.
Yes, I think community engagement is critical, and in those places where we find they're having the most success, they have found a way to reach out and connect with their community. And I think that's most often done by working with parents. I think Raven has been an excellent example on this call. We have a parent advisory council with about 10 people from across the country serving on it, but they have all been parent leaders at the local and state level before joining our council. And these parent leaders that work at the local level, I think, are ideal for informing practitioners about how to best connect with people who may need and want services. So I think community engagement through the family resource centers is important too. In some communities, they've been around a long time and people in the community are aware of them. And word of mouth from good service helps to continue some families accessing those. I don't know if many people on the call were able to see the film Tuesday morning that the Children's Bureau had a program celebrating Child Abuse Prevention Month, and it featured a family resource center in San Francisco that's been around for decades. And it featured a parent who's almost raised her children within the center. It started with her when their first baby was born, and now that child is about 20. So often those centers can be places, I think, where people feel comfortable, where they feel heard, and where they feel like they can get services and resources that are meaningful, that are really useful and transformative, to go back to that word. So that's what I would say about community engagement. It is critical. Programs where they're not able to engage with the community don't last and are not able to be successful in making the changes that they wish to make. So that's what I guess I would say, Alisa.
Thank you. Thank you. You know, I want to leave some time. In our previous panel, we talked also a lot about the challenges. And in this panel, I really would like to dig a little bit deeper into our panelists' views about, from your perspective, what is working, what are the opportunities now to do things differently, how we are connecting with our families and our communities, and ways that we can help support prevention. So Raven, I think I'd really like to give you some time here to share your thoughts about what are the kinds of things in this moment that we can do differently that might be sustainable so that we can transform, how we work with our families now.
I know that I can say now, and actually what Valerie add to agree, about the community. I think right now, let me go back. As a result of our pilot review, I was asked to be a part of one of the hot spots here in Louisiana. a pilot called My Community Cares, and it's bringing them the data for disproportionality and disparity in acting. We're just bringing their data to the community, showing them their data, and and asking for their solutions, needs, and the successes. Just expressing their cares and concerns, right? And we talk a lot and we hear a lot about community engagement. Right now, especially with this COVID-19 happening, I think that's where our focus should be, all around community engagement. Because at the end of this, and right now, I see a lot of community organizations trying to do the best that they can with what they have. And by all means, I see, people are really trying to figure this out. This is really a life-threatening experience or deal that we're going through, So I want to say this. I think we need to really, really capture community engagement, right? Because I know often we get community engagement, confused with community outreach. But we really, when this is all said and done, these communities are losing money right now. They're losing business. And we losing community members, right? People are actually dying from this pandemic. So in focus needs to go back into community engagement. And, I believe we should leave families better than how we found them. And that's not happening right now, especially we just leaving them and trying to figure it out, right? But community engagement is big right now, and it's what they're going to need to rebuild, to come back from this ordeal. Thank you.
Raven, I really liked what you just said about drawing a distinction between community outreach and community engagement. And I just want to follow up with you for our participants. Can you just share a little bit about what those differences are for you and what becomes more meaningful with that engagement?
Yes. But so much outreach is simply giving out certain things. What may not be what that community needs. Community engagement, actually getting them involved, having them voicing and expressing themselves and their concerns and their needs, instead of community outreach just handing out just because there's a program and there's funding, and not really hearing. And it's not what their need. It's not their need. So many, for so long we've been doing what the state has always done. So we haven't had any different results because, and someone said earlier, and it really captured me, we're so busy moving the furniture around that we're not actually thinking about just restructuring, right? Fixing up the house. We just want to move furniture around. So that's why we've always getting what we've always done, and we're going to always continue to get the same results. And families are being separated, not getting the actual help that they need, because we're so busy just trying to shift things around instead of restructure our system.
Thank you. That's an excellent way for us to think about it. And Valerie, I'm just going to go to you next, just in terms of, what are some opportunities that you see in this moment about what could be sustainable and what's working?
Sure. A couple of general things I'll say to start. I think that we've heard many people say we're having more contact. I think, obviously, the pace of activity has slowed for almost everyone except for our healthcare providers and maybe our grocery store workers. But there's more time for contact, and so that's been a plus. There's more time for deeper conversation. I also think this period is pointing more to disparities. Many of us have been seeing this for a long time, but there's a large part of our population that doesn't see it, that the economic disparities, the racial disparities, ethnic disparities are not sustainable for a healthy country. And so I think, I wonder, will we find a way to respond to what we're observing as this all ends and become a better place? Two more specific examples I would share of what's working. I just want to touch on respite services. I think they are critical to helping families that are strained and stressed. there are several states through their CBCAP dollars that offer respite, but there are many other respite services as well funded with other dollars. In Illinois, for example, they have crisis respite nurseries. And often these are for families with infants and very young children, but they can be provide respite services to families with children up to the age of 17. But they provide temporary respite or short breaks, as they're called in other parts of the world, to families experiencing challenging life circumstances that could put them at risk for abuse or neglect. So these periods of short respite can often be just enough to give the parents a break, to relieve some of the pressure, to allow them to take care of some things that they need to have done, and to prevent an incident that could create, a DSS referral. A few states have crisis nurseries, but in a much better world, we'd have these available in every community where parents who are reaching their breaking point could reach out and get this period of time when they can turn their child over to a service that is supportive, that's temporary, and that they know that they will be able to, in 24 or 48 hours, their child will be there safe and sound to return to them after they have had a chance to get some sleep or to get some groceries or in more normal times maybe to go to a doctor's appointment. The other example I'll share of what we've seen change quickly, we have been really impressed with how quickly the state lead agency, the CBCAP state lead agencies around the country, modified their child abuse prevention awareness activities. Most states do a number of activities every year to try to raise awareness around the issues of child abuse, to advocate with legislative bodies, to promote resources that support prevention and help to strengthen families. And we have received dozens of reports from states and examples of how they've made these awareness-raising events virtual this month. And we've reposted them on our Facebook page. In North Carolina, for example, they have 9 events. So I would have expected, this whole crisis came about and we're going to do one thing to try to replace, all of what we were doing. But they have still somehow shifted to do 9 events and activities throughout the month of April. Anything from having a day where they're encouraging people to wear blue to a virtual town hall where they have policymakers participating and hearing more about some of the issues. Texas has created a website called Help for Parents, Hope for Kids, and it has videos on it, a calendar of tips for every day, multiple resources for parents that need extra help, everything from hotlines to other resources, missionary services, charity services that people can call when they're in need. But across the country, prevention leaders, including parent leaders, are developing creative approaches to reaching individuals and their communities with resources and information using those limited resources that they have in the prevention world.
Thank you, Valerie. Deborah, can you share a couple of thoughts about what's working or what opportunity we have now in terms of some of these policies or practices or services?
Yes. We're looking at small solutions. So, for example, at the program level, in addition to deploying supportive services to families, we're beginning to prepare activity kits to distribute to families to encourage engagement with staff in our virtual home visits. An example at the community level, we are among several service providers in the community who are mobilizing around our population who experience homelessness. In Anchorage, people who are experiencing homelessness are now being housed at our local sports arena, and tents have been constructed outside the sports arena for various service providers. We are among them for people who are living in the sports center to come out and access resources for housing and other concrete needs. There are now limited mobile health services offered there. And we've seen something like this when we visited a community of Hope site in Gainesville, Florida. It's really exciting to bring services to where people actually are. Our local community mental health center has also created a presence there, helping people who are on psychotropic medication to keep up their medication so they don't have a break in their treatment. So we're really excited about that. Within our tribal community, Cook Inlet Tribal Council has donated to the local food bank, who then is distributing food to the villages outside of Anchorage who are in our region. And although we're no longer able to have kids on site at our Fab Lab, staff who are in need of extra work have been deployed to use the 3D printer to make masks that we're distributing out to our tribal communities. So those are pretty exciting, and we certainly, as always, are looking to find the opportunity in crisis. And this particular crisis presents many opportunities to shake up business as usual. And, you know, we've thought about our collaboration efforts are typically aimed at engaging partners in shared work by developing consensus around the shared value added when we agree about who our common participants are and learn about what is really needed. So we think, you know, this is the why of working together, and the how is really helping us all to care more about the same people and issues to mobilize solutions. So what we've seen thus far is really kind of a shifting in perspective out of necessity. We're thinking less about why we should be working together and more about why not or why can't we. So we're really encouraged that this is going to generate many innovations as a result of this work we're doing together, and especially recognize that the active ingredient in all of our services is relationship, and we know this is especially true of prevention.
Thanks so much, Deborah. And Allison, we're coming to a close here, but any final thoughts for you from your perspective?
Sure. I had a longer list, but I will limit it to one, and I think it piggybacks on what Deb is saying. I hope that this pandemic will bring to America some additional empathy and understanding. I think many families are finding themselves in situations they never expected to be in: unemployed, underemployed, incredibly stressed out, under-resourced for their retirements, worrying about their family's mental health. And I would love to see more Americans really adopt the adage, "But by the grace of God go I." Any family can find themselves in a challenging situation at any time. And I think the prevention work that our grantees are doing and the child welfare community is moving to more broadly really deserves a lot of recognition for filling in those spots when families find themselves in hard times. And I would love to see us as a society collectively appreciate that work more and elevate it and support it, both in attitudes and financially.
Thank you so much, Allison. I know that we've had a long morning for a lot of our participants. We're going to show the word cloud that people participated in. This was a great discussion. We really want people to we really want to thank everybody on the call, who participated in the dialogue with this webinar and the next webinar. As you can see from the word cloud, there's a lot of the themes that we've talked about today in terms of services and money and treatment and understanding. So I think this is really reflective of this conversation and even the conversation that we had prior to this. I really appreciate everyone's time and attention and all the work that you're doing on behalf of families, both to our panelists and to our participants who have joined the call today. We will have both of these panels recorded and they will be posted on our site. So again, I just want to thank everyone for joining today, and I wish you all safety and wellness and health and humor, as we've talked about, and invite you all to keep checking in with us and on our website for additional information and resources. Thank you. This will end the webinar today.